Meanwhile, across the country, there are many questions surrounding reproductive care for women and the impact on abortion access under the Trump administration. Now, just last week, his administration cut funding for family planning clinics across the country. And this comes as Planned Parenthood of Massachusetts says it's seeing more out-of-state patients coming here to receive care.
Since April 1st, the Trump administration withheld Title X funding for reproductive facilities, including 9 Planned Parenthoods across 20 states. Massachusetts is not one of the states affected by this latest move. President and CEO of Planned Parenthood League of Massachusetts, Dominic Lee, sitting down one-on-one with me to talk about the possibility of funding cuts here.
It's going to have real irreparable damage to a number of communities that are already vulnerable and marginalized and already disproportionately impacted.
She says women are coming to Massachusetts to receive care, including abortion, where it's legal and accessible.
In particular, 30 states throughout the country and 13 banned states, with most of our patients now traveling from out of state from Texas, Georgia, and Florida.
The chief medical officer at PPLM says those women in restrictive states have to jump through many hoops, like arranging transportation, just to receive health care.
For every one of those patients, there are dozens of those patients who don't get to come and see me and have to accept the very real physical and financial and emotional risks.
In Massachusetts, Title X grants fund more than 90 healthcare sites to over 97,000 patients. The services range from contraceptive and infertility services to pregnancy testing and screenings for cervical and breast cancer and STDs. So let's say they do cut funding.
Sure.
And that's the reality. What happens next?
Part of the scenario planning is for how do we continue to support those programs, either through philanthropy efforts or working with our constituents.
Lee says they're working with state leaders to create a family planning reserve fund in the state budget.
Most of our patients that we're hearing from are scared. They're anxious. They don't know what it means for them. But, here at PPLM, our doors are open. Our services are here. We will be here forever as hard as we fight.